Well, for more on the state of COVID testing, I'm joined live via Skype by Dr. Kate Tulenko. She's the CEO of global health firm Corvus Health. Always good to have you on.
Good evening.
So let's first start by talking about Hong Kong's plan for mass community testing and how that compares to other approaches.
Well, Hong Kong is following the game plan that has been used in China, particularly in Wuhan and other places, of doing the mass community testing. In the space of a week, Hong Kong plans to test 5 million of its 7 million residents.
So then as we look then to the US now, the latest on the CDC guidelines, the new recommendations were released and then clarified by the director, but guidelines saying that the testing is not necessarily needed if you've been exposed but have no symptoms. How does this move impact America's ability to contain the virus and reduce infections?
Well, these recommendations have been highly controversial, and most states most likely will not follow the recommendations. I don't know a single medical organization that supports the new recommendations, and it's believed that potentially there's been pressure from the Department of Health and Human Services and the White House to pressure the CDC to make these changes.
So when you have this sort of messaging and tweaking, what does that do for really public confidence in the information that's coming out?
Yeah, it's not helpful. There's no doubt about that. And this also comes on the tail of controversy over the use of convalescent plasma with COVID. So it really doesn't help people increase their trust. And so it's even more important that states reach out to communities, reach out to community leaders, and get consistent messages across.
Now, what do we know so far about the Trump administration's plan for expanding testing?
So they made an announcement that there's now a $750 million deal with Abbott Laboratories to produce 150 million new tests. And Abbott has just come out with a new rapid testing kit that can test people in 15 minutes, and it has very low rates of false positives and very low rates of false negatives. The U.S. is currently testing about 40 million people a month, and so this potentially could double the number of tests that can be taken. And also, as you know, one of your reporters was previously saying, there's now an app that most people can download. It uses Bluetooth to tell them whether or not they've been exposed to someone with COVID.
Now, for people who've gone through the testing process, it really can vary as to at your doctor's discretion as to whether they perform the rapid test versus the test that can take a lot longer to get the results back. Do we know about any sort of progress on that?
Well, the progress definitely is in the Abbott test, that there's now this new rapid test. So the slow test is the PCR test, which detects the viral RNA and is more accurate. And then the rapid test is the one that detects the viral antigen, the viral protein, but that has much higher rates of both false negatives and false positives. And that was seen a couple of weeks ago when Mike DeWine, the governor of Ohio, was tested positive with a rapid test, but then when he took the PCR test, it was negative.
Now, unfortunately, there's also a lot of private companies getting into this, selling some of these home testing kits direct to consumer. What are your thoughts on those and their accuracy?
This has been very controversial because it's sort of the two Americas, the Americas that can afford rapid testing and those who can't. We've heard reports of people testing guests coming for dinner parties and things like that. And certainly we've seen professional sports teams are able to test their players, whereas symptomatic people in the community can't get testing. So it's looking at access is very important. There's no doubt we have to increase access to testing. I mean, I would love it if every week children in school could be pool tested, that every child in that class tested together. If it's positive, the group needs to quarantine and you can retest them individually.
So then if we take a holistic approach, then what other tools work best in conjunction with testing to really help us get a better picture of who's infected and whether we ourselves should get tested?
Well, it's, a lot of it is modeling how it's moving around in the community, doing that contact tracing. But really, the testing is the most important part of finding out who's positive. Of course, we do our social distancing, wear our masks, wash our hands, but testing is going to be crucial. Until there's a vaccine, we really need high levels of testing.
So then you mentioned the Abbott test. What other sort of tests are out there? And what sort of role is that going to play, having these different tests out there, at least until a vaccine is available?
Well, I think the more tests, the better, because it will give more people access and access at a lower cost. There's now the spit test, there's a cheek swab test, there's the nasal tests. You can get a blood test which detects the antibodies. So I think the more tests out there, the better. Now, different tests do have different false positives and false negative rates, but I think as long as people are counseled properly and they understand that they could have a false negative or false positive, it's good that there are as many testing kits out there as possible.
We appreciate you sharing all that important information. Dr. Kate Tulenko, the CEO of Corvus Health.